If you've been following along on this journey, you know that a week or so ago, I filed a request under the Georgia Open Records Act to try to obtain a copy of Daniel Benoit's autopsy. And the stuff I have blacked out here is just my full name and email address, nothing really important. And immediately after submitting the request, I received the automated response notifying me that it would take approximately 15 days for my request to be reviewed. Now, I really didn't expect to have any luck, as any document pertaining to juveniles are typically very difficult to obtain, and oftentimes the records are even sealed. So just imagine my excitement when I received this response within 7 business days of sending the initial records request. And when I noticed that the autopsy report was indeed attached, I couldn't help myself. I had to do a little happy dance of excitement. I opened the document right away, and then I saved it in my Books app. And the white page right here, that is the Benoit files that I have, the police files. And you can see we've only gone through 46% of that so far. So we are just about halfway through. We still have a lot to go through. But this here, this one that says new, this is Daniel's autopsy report. So we're going to open this up. And there's 5 pages. You can see up here in the top right, this is page 1 out of 5. And it follows the same format. If you watched the previous videos where we went over Chris Benoit and Nancy Benoit's autopsy, it's the same format. So you should be a little bit familiar with that if you've watched that. So let's just get started reading through this here. So you can see at the top, report date 8/27/2007. Right here is where I'm looking. And then, of course, all the official information. And case individuals right here. Victim, juvenile, Daniel Benoit. And we'll go through the results and conclusions. And just a reminder that this section of the autopsy report is outlining the findings listed in order of relevancy. And then the subpoints list the findings that support that conclusion. So I'm going to do this one a little bit different than I did Nancy and Chris's autopsies. I'm going to read through these final diagnosis results and conclusions. And for the first 2 findings, I'm going to go into more detail with what I found when I was researching that as to how that attributed to his death and a little more information about that. So let's start reading through these results and conclusions and see what we find. Final diagnosis, number 1, cervical compression with A, hemorrhage, left sternohyoid muscle. B, petechiae, face, eyes, mouth. Number 2, acute alprazolam intoxication. Alprazolam is Xanax. What have we been talking about when we were looking at all of these reports when they say that Daniel was sedated almost to the point of unconsciousness, but they keep reaffirming that that was not his cause of death. His cause of death is cervical compression. So just like I've done with everything else as I'm researching this, I wanted more information on that. So I come to DuckDuckGo, type in cervical compression, and what do I find? Cervical traction, cervical nerve compression, neck pain, cervical decompression, all of this, but nothing about it being like a cause for a death. Spinal cord compression, symptoms, causes, diagnosis, signs and symptoms of upper cervical disorders, but nothing about injury or death. So I thought, well, maybe I needed more narrow search results. So cervical compression of the neck. Okay, still nothing. Sale on cervical neck device, cervical neck button pillow, cervical nerve compression, neck pain, treatments, neck pain solutions. So I'm like, what the hell? So next thing we add to this, cause of death. Right? They tell us that cervical compression is the cause of Daniel's death. So cervical compression of the neck, cause of death. And what we get here is death following accidental compression of the neck by safety harnesses. Work-related, I'm here at the abstract, work-related fall from a height many a times causes fatal injuries and death amongst working in various construction sites. It leads to different types of fatal bodily injuries, including spinal injuries causing economic burden to the family. and it talks about them being provided with protective gears and proper training, but that sometimes accidents do happen. Accidental compression of the neck by safety harness following a fall from height has rarely been described, leading to death of the individual. A case was brought for autopsy following accidental compression of neck structure causing fracture of cervical spine and transaction of spinal cord. So, doing a simple internet search, what I find for death due to cervical compression of the neck is that it is rarely even the cause of death when somebody's fallen from a great height and got their neck stuck in a safety harness that led to compression of neck structure causing fracture of cervical spine, which would lead to death. So did Daniel have a fracture in his cervical spine? I guess we'll find out as we read. But then the only other thing I could find was this from PubMed from the National Institute of Health. And unfortunately, on this website, we can only read the abstract, but that's because this website, PubMed, is a database of articles from peer-reviewed journals. Some other websites like that you might be familiar with are like LexisNexis, which is mostly focused on law and industry, and there's the APA PsycInfo database. And when you're in college, as part of your tuition as a student, you have access to sites like this. And that's because when you are doing research and you are presenting an argument to a professor, you need to have your arguments backed up by accredited sources. So, for instance, if you would cite Wikipedia as a source on a research paper that you would turn into a college professor, you would be laughed at because Wikipedia is not considered an accredited source. And unfortunately, since I am no longer a student, I would have to pay for access to these sites, and it's pretty expensive. But usually you can at least find the abstract, or sometimes they will have key findings that you can sort of get an idea from the summary about what direction the research went in and how it progressed and what was determined from the research. And in case you haven't noticed, most of the articles that I cite in my research come from these accredited sources, such as PubMed, National Institute of Health, etc., because I am looking for science to back my research and conclusions, and not conspiracy blogs. Don't get me wrong, if the research leads me to conspiracies, I will look. But mostly, I'm really trying to provide you with sound, accredited, peer-reviewed resources. So a little trick I've learned is sometimes when you're doing a search, if you need to find more information, a little trick that I've learned is if you go to your search engine, and like for instance here, I just copied and pasted the title of this article into the search engine and I added PDF to it. And sometimes you get lucky and you can find the PDF, the full PDF of the article for free. The PDF is right here, so it's the full article. This is about 3 cases of asphyxia caused by atypical compression of the neck by the metal bed bars fitted at the sides of the bed to prevent falling out. This occurred in 3 elderly women living in nursing homes confined to bed by severe neuropsychiatric disturbances. So basically, as for a cause of death being cervical compression, there's not a lot of information about it. So that's number one that I find weird, that this cervical compression is somewhat rare and rarely happens as a cause of death. And yet, despite there being acute alprazolam intoxication, they're sticking to their guns and saying the cause of death is the cervical compression to the neck. Let's keep going. Acute alprazolam intoxication is number 2 on their results and conclusions. And the subpoints that they offer as findings to corroborate the acute alprazolam intoxication are A, C toxicology report, and that's coming next. B, cerebral edema. C, pulmonary congestion. Okay, so I'd like to take a closer look at the alprazolam intoxication. So here we are at drugabuse.com, Xanax overdose symptoms, signs, and treatment. So what is Xanax, also generically known as alprazolam? It's a benzodiazepine commonly prescribed for the treatment of anxiety and panic disorder. And what I want to draw your attention to here is here where it says, why is Xanax dangerous? Xanax poses such a serious threat of overdose because the effects of the drug occur quickly after the drug is ingested. Compared with many other drugs, Xanax is relatively fast-acting. Shortly after being taken orally, it is absorbed through the GI, the gastrointestinal tract, into the bloodstream, then shuttled to the brain, where it begins to exert its effects. When too many Xanax tablets are consumed at once, the body may quickly become overwhelmed with the massive dose. And acute alprazolam intoxication means it was pretty serious. Acute means severe. And I'm going to give you a bit of a spoiler from the toxicology report. And you can see right here that Dr. Sperry says that the results of Daniel's blood toxicology indicates a level equal to 3 or 4 of the 2 milligram alprazolam pills located in the Benoit residence. So what is my point here? When you look down here further, signs and symptoms of Xanax overdose. And it starts by saying, due to its quick onset of action, early signs of overdose resemble side effects of regular Xanax use. And it's not really anything major, you can look through it. But when you scroll down here, it says, some people experience more severe side effects and warning signs of an overdose, and then these symptoms are a bit more severe. But then it goes on. Any of these signs or symptoms can indicate a potential overdose or a serious adverse reaction to the drug. If a person is overdosing from Xanax use, they may have symptoms that include, and look what we have here, severe drowsiness and an inability to stay awake, significantly slowed breathing, unresponsiveness, loss of consciousness, and coma. Okay, and the next thing in the first subpoint under acute alprazolam intoxication was cerebral edema. So cerebral edema is swelling of the brain due to excess accumulation of fluid in the intracellular or extracellular spaces of the brain. So here we have healthline.com. What is cerebral edema? It's also known as brain swelling. And when we scroll down farther, what causes cerebral edema? You have some factors listed here that are probably the most common causes. But then right here, it says other causes of brain swelling include, and look what we have here, unhealthy use of drugs. And also the next thing I want to look at, pulmonary congestion, which is also known as pulmonary edema, which is liquid accumulation in the tissue and air space of the lungs. Both cerebral edema and pulmonary congestion are subpoints that they feel is related to the acute alprazolam intoxication. So when I go here, Healthline, to pulmonary edema, and we scroll down here to causes, well, you have medical conditions, and here we have some external factors that can also put extra pressure on the heart and lungs and cause pulmonary edema. And look what we have here, illicit drug use or drug overdose. So those two things, the swelling in the brain and the fluid in the lungs, was caused by the alprazolam intoxication. Now, those are the main things that I wanted to draw your attention to. So now let's go back to Daniel's autopsy report and see what else we can learn from that. Number 3, blunt impact of head with A, subscapular soft tissue hemorrhage. 4, blunt impact of extremities with A, abrasions. And 5, accessory spleen. And I thought, wow, that's interesting. What is that? Well, we're going to find out what that is. Let's keep going. We'll go through this in order. Cause of death, cervical compression. Manner of death, homicide, see above. And then the disclaimer, I hereby certify that I, Jonathan Eisenstadt, MD, in accordance with the Georgia Death Investigation Act, have performed an autopsy on the body of Daniel Benoit on the 26th day of June 2007, commencing at 9:30 a.m. in the morgue of the Georgia Bureau of Investigation, Division of Forensic Sciences. So let's get into it. External examination. The body is of a well-developed, well-nourished, 4 foot 4 inch, 63.4 pound white-skinned boy whose appearance is consistent with the given age of 7 years. The scalp hair is coarse, dirty blonde, and up to 3 inches. The eyes have brown irides and the corneas are clear. The conjunctivae are without edema or jaundice. The oral cavity has natural teeth in poor repair with hypertrophy of the gums and an atraumatic mucosa. So what is hypertrophy of the gums? So here we are at healthjade.net. Gingival hypertrophy, also known as gingival hypoplasia, gum hypertrophy, or gingival enlargement, refers to excessive growth of the gums or gingiva around the necks of the teeth. The hypertrophic gingival tissue may be inflamed, gingivitis, in which case the gums are red, soft, shiny, and bleed easily. One of the causes is inflammation. The inflammation can be induced by poor oral hygiene or from a dental appliance like orthodontic braces. Other factors include systemic conditions like hormonal imbalances or leukemia, medications or hereditary conditions. Also, localized overgrowth can be a benign or malignant lesion. Once gingival hypertrophy has started, it is difficult to maintain good oral hygiene. Poor oral hygiene also can increase inflammation that can be a factor in gum hypertrophy. In general, your ability to practice effective oral hygiene measures on a daily basis helps to reduce the risk of developing gingival enlargement. You may need to undergo more frequent professional cleanings or may be instructed on ways to improve your brushing technique. Effective oral hygiene is especially important for managing gum hypertrophy caused by chronic inflammation and cyclosporine. And what are some of the symptoms? Gum hypertrophy may cause discomfort, interfere with speech or chewing, result in halitosis, bad odor to the breath, and it may look unsightly. And what is the treatment? Treatment depends on treating the underlying cause. Gingivitis may improve with the following measures: removal of bacterial plaque by thorough toothbrushing and flossing, antiseptic mouthwashes, ultrasonic treatments, courses of antibiotics to reduce oral bacterial load, like erythromycin or azithromycin. And as always, links to all of these articles that I cite are in the description box below. So let's get back to Daniel's autopsy report. And moving on to page 2. The nose and facial bones are palpably intact. The neck is unremarkable. The extremities show no scars overlying subcutaneous vessels. A 1/8 inch in diameter crusted abrasion is in the left antecubital fossa. A cluster of circular and linear abrasions ranging in size from 1/16 to 1/8 inch is on the dorsal left forearm, and a 1/8 inch abrasion is on the dorsal right forearm. A 1/8 inch abrasion is on the right knee. A 1/2 inch linear abrasion is on the distal right leg, and a 1.5 inch linear abrasion is on the anterior right ankle. A 2 inch vertical abrasion is on the anterior left leg. A 1/8 inch in diameter abrasion is between the left third and fourth toes, and a few 1/16 to 1/8 inch abrasions are between the left second and third toes. Multiple 1/16 to 1/4 inch round abrasions are on both legs. The nails are slightly long. The torso is unremarkable. The external genitalia are atraumatic and of a normal circumcised boy. The following well-healed scars are on the body: scattered 1/8 inch diameter on back, 1/8 inch diameter on volar left forearm, 1/4 inch horizontal on dorsal right forearm, multiple 1/16 to 1/4 inch round on both legs. Now, I just want to say, these round scars, they bother me. And the little cuts between the toes bothers me as well. I will not elaborate further on why those two things bother me because I don't have any evidence, not even any speculative evidence, to support my reasoning. So at this time, it's completely inappropriate for me to say anything more. This one was really hard. I had a hard time with Chris and Nancy. I'm going to cry. I had a hard time going through Chris and Nancy's autopsies and looking up all of that stuff and trying to picture what could have happened there. This one was worse. And I don't mean that the information in here is worse. I just mean knowing that this was just this was a little boy. It was hard. So anyway, there are no tattoos. Post-mortem changes. There is minimal rigor mortis. Lividity is pink, purple, fixed, and on the anterior surface of the body in a patterned fashion. There are petechiae with tardive spots on the chest. The body is cold, refrigerated. Early decompositional changes include green discoloration of the abdomen, right side greater than left, and mummification of the tips of the fingers. And that was mentioned in Detective Harper's summary of the autopsy reports. Remember, when I did that video, I said that you should really pay attention to that because that would be the only information from Daniel's autopsy that we could get. And luckily, through fate or whatever, I was able to get this copy of it so we can see that, yep, he did have mummification of the tips of his fingers. Clothing. On the body are one multicolored SpongeBob SquarePants pajama top and one multicolored pajama pants. These are submitted as evidence. Injuries, external and internal. Cervical compression. There is no evidence of external trauma to the neck. Petechiae are over the forehead, eyelids, nasal bridge, and mucosal surface of the lower lip. A petechial hemorrhage is in the upper bulbar conjunctiva of the right eye, and a petechial hemorrhage is in the lateral aspect of the bulbar conjunctiva of the left eye. There is a focal hemorrhage within the left sternohyoid muscle. And now remember, we already looked at deaths caused by cervical compression of the neck, and I said, we'll see if Daniel had any fractures to his cervical area. Well, here you go. There are no fractures of the cervical vertebrae, hyoid bone, or thyroid cartilage. So there you have it. And keep all of this in mind because at the very end of this video, I have a serious question for you guys. I might have to do in 2 parts, so it'll be at the end of the second part. Because I need to get through this information first. I'm building towards something, so for now, let me just keep going through here. The soft tissues of the posterior neck are without hemorrhage. Blunt impact of the head. Now we're moving on to page 3. There is a 1/4 by 1/8 inch area of pink-purple discoloration on the right side of the jaw near the angle of the mandible. There is a focal area of hemorrhage in the subscapular soft tissues of the left side of the forehead. There are no fractures of the facial bones or skull. These injuries, having been described above, will not be repeated. Now, I hate to do this to you, but in order to avoid the problems I had with the previous videos, I'm going to end this here. I'm going to upload them at the same time. So right now, for the rest of Daniel's autopsy report, jump to part 2 of part 12. And I'll see you when we get there.